EKG Quiz Part 1. A patient with the left arm amputated comes in for an EKG. Which of the following is the proper placement for the left arm lead on this patient? A. The same as it would be for a patient without a left arm amputated. B. Move to the back on the side of the left shoulder, moving the right lead to match. C. As close to the side as possible but higher on the limb and in a similar position. D. Move to the back side of the left shoulder and in a similar position. Answer: C. As close to the side as possible but higher on the limb and in a similar position. Which of the following should be adjusted when running an EKG on an infant or child? A. Amplitude. B. Sensitivity. C. Speed. D. Stylus position. Answer: C. Speed. A patient on drop-it precautions needs to be moved from his room to a testing facility for a stress test. Which of the following precautions should you take? Select the two correct answers. A. Wear a mask and gloves. B. Put the patient in a clean gown with a mask and gloves. C. Have the patient wear a mask. D. Have the patient wear a HEPA or N mask. E. Evacuate the route to the testing facility during the transport. Answer: A. Wear a mask and gloves. C. Have the patient wear a mask. Where should the V4 electrode be placed on the body? A. Left mid-clavicular line, 5th intercostal space. B. Right mid-clavicular line, 5th intercostal space. C. Left mid-axillary line, 5th intercostal space. D. Right anterior axillary line, 5th intercostal space. Answer: A. Left mid-clavicular line, 5th intercostal space. Which of the following resources must be available for a patient undergoing a stress test? Select the three correct answers. A. Protective gown and mask. B. Defibrillator. C. Crash cart. D. Special camera or scanner. E. Oxygen. Answer: B. Defibrillator. C. Crash cart. E. Oxygen. When performing an EKG on a pregnant woman in her third trimester, you should place the A. Lower limb leads on the patient's ankles. B. Patient on her right side and lower limb leads on the lower abdomen. C. Lower limb leads on the patient's side. D. Patient on her left side and lower limb leads on her upper thighs. Answer: D. Patient on her left side and lower limb leads on her upper thighs. Reminding patients to refrain from talking and moving and keeping them warm during the EKG procedure are important to help eliminate A. Somatic tremor artifact. B. Wandering baseline artifact. C. Alternating current interference. D. 60-cycle interference. Answer: A. Somatic tremor artifact. When performing a 12-lead ECG, which of the following positions demonstrates correct lead placement? A. V4 is placed left mid-clavicular 5th intercostal space. B. V4 is placed left mid-clavicular 4th intercostal space. C. V5 is placed left mid-axillary 5th intercostal space. D. V5 is placed left mid-clavicular 4th intercostal space. Answer: A. V4 is placed left mid-clavicular 5th intercostal space. When working with a patient with methicillin-resistant Staphylococcus aureus, you should A. Take the precautions for a contact pathogen. B. Use a special mask as it is an airborne pathogen. C. Use the procedures for reverse isolation. D. Use gloves and a mask if the patient is being treated. Answer: A. Take the precautions for a contact pathogen. Which of the following instructions should be given to patients prior to stress testing? Select the two correct answers. A. Wear comfortable clothes, including athletic shoes. B. No food or drink is allowed after midnight prior to the test. C. Refrain from alcohol, tobacco and caffeine 48 hours prior to the test. D. Take all prescribed medications 2 hours prior to the test. E. Eat a light meal 2 hours prior to the test. Answer A. Wear comfortable clothes, including athletic shoes. E. Eat a light meal 2 hours prior to the test. Ventricular pacemaker cells are found at the A. left bundle branch, B. Purkinje fibers, C. right bundle branch, D. SA node. Answer B. Purkinje fibers. In a patient with a heart that deviates to the right of the sternum, you should place the precordial leads in which of the following positions? A. Posterior to the positive electrode, B. Right to left, C. Left to right, D. Anterior to the negative electrode. Answer C. Left to right. While performing an EKG on a patient, electrodes keep falling off. Which of the following you should do? Select the 2 correct answers. A. Place tape over the electrodes. B. Clean the skin with soap and water. C. Clean the skin with 70% isopropyl. D. Reposition the electrodes. E. Ask the patient to sit on her hands. Answer A. Place tape over the electrodes. C. Clean the skin with 70% isopropyl. During a patient's yearly checkup, the physician orders an outpatient EKG. Which of the following instructions are likely to be given to the patient at the hospital? Select the 2 correct answers. A. Wear comfortable clothing, including athletic shoes. B. Do not use any lotions or creams. C. Remove any stockings and roll-up pants. D. Remove all piercings. E. Have someone available to drive you home. Answer B. Do not use any lotions or creams. C. Remove any stockings and roll-up pants. During an EKG, the right leg provides grounding for which leads? A. Bipolar, B. Augmented, C. Chest, D. Precordial. Answer B. Augmented. When performing an EKG on a child, you should place AV3 on the right side of the chest, BV4 2 inches lower than on an adult, CV2 on the right side of the chest next to V1, DV6 posterior wall of the chest. Answer AV3 on the right side of the chest. To prevent a wandering baseline artifact, you should ensure the patient is A. Positioned with his hands under their buttocks, B. Not wearing any metal jewelry, C. Moved away from the wall if in a hospital bed, D. Cleansed with alcohol prep pads. Answer D. Cleansed with alcohol prep pads. You are preparing to perform an EKG on a patient with a total left arm amputation. How should you place the arm electrodes? A. Place both the right and left on the upper outer shoulder area. B. Omit the left electrode and put the right on the upper outer arm. C. Put the right on the upper outer arm and the left on the torso below the clavicle. D. Put both the right and left on the torso below the clavicle. Answer D. Put both the right and left on the torso below the clavicle. A 3-month-old patient is fussy and moving his arms and legs. Which of the following in order to get proper electrode placement for an accurate EKG? Select the 2 correct answers. A. Soothe the child with a pacifier. B. Only place precordial leads. C. Use a reward system. D. Allow the parent to hold the child. E. Allow the child to get familiar with the equipment. Answer A. Soothe the child with a pacifier. D. Allow the parent to hold the child. Placement of the ground lead on an EKG is on the ARL on the muscular portion of the leg, BLL on the soft tissue of the leg, CRL on the soft tissue of the leg, DLL on the muscular portion of the leg. Answer CRL on the soft tissue of the leg. Proper electrode placement for continuous EKG monitoring is identified by the use of A3 leads placed on the patient's torso, B5 electrodes placed on the patient's extremities and torso, C10 electrodes placed on the patient's torso, D12 electrodes placed on the patient's extremities and torso. Answer: 8 leads placed on the patient's torso.